Hi, I'm Michael Wright. I'm Chief Executive of Nottinghamshire Local Medical Committee, LMC. And I just want to tell you more about why we go to the LMC conferences. We just recently went to the UK LMC conference in York, and the committee sent 5 delegates on your behalf to go and discuss different motions that were posed, some of them submitted by Nottinghamshire LMC. And the point really is to help inform GPC policy in their negotiations with NHS England, GPC being the general practice branch of the British Medical Association. So that's the point of the conference. It's democracy in action. So it is your elected GP representatives, being your representative body, who then go to conference and debate on issues affecting general practice. And we're just at the point where we are now 3 years into a 5-year contract deal, and there's a lot out there to play for in terms of what's going to happen after 2024, after the end of March 24. So we need to work hard. We need to work hard on your behalf. We need to understand what you need in your practices, and we know how tough it is for you out there. So we want to thank you, but hopefully reading the outcomes from conference this year and watching the video will help you to understand more about what we do on your behalf at national level. Thank you.
I'm Carter Singh. I'm the Nottinghamshire LMC chairman, and I attended the UK LMC conference in York on the 10th and the 11th of May. There was a lot of interesting debate, but 3 motions caught my eye. They were motions number 6, solutions to workload, motion number 8, safe workload limits, and number 10, solutions for workforce. I spoke on these motions, and my thoughts were that we all agree that intolerable, unsustainable, unsafe workload leads to burnout. In years gone by, some GPs wore the number of patient contacts as a badge of honour, but there is no honour in the graveyards where these GPs and their patients may have ended up. Whilst I don't disagree with motion 6, I think we could build upon this motion because we don't need yet more data to tell us what we already know and to understand how denigrated, downtrodden and dejected our profession is feeling. This is more than adequately evidenced by the suicide rate and recruitment and retention crisis. Data without action is meaningless. We cannot continue to treat general practice as a sinkhole absorbing unlimited work. Just because we can doesn't mean we should. This dumping of work has become an abuse of goodwill. A willing horse carries a heavy load, and that horse is now ready for the knacker's yard. GPs that have pushed back against this dumping of work have been branded as callous and irresponsible. They have been witch hunted by the media, politicians, and by public and the regulators. So I hope that by carrying these motions forwards, we can really affect genuine and positive change.
The motion that stands out for me is the motion 10, solutions to workforce. This motion talks about enabling visas for relatives of adult relatives of NHS workforce who are working here. There is a campaign is being led by BMA along with organizations like BAPIO and APNE. And we have had they've managed to lobby one of the MPs, Mr. Stephen Timms, to raise this debate in May this year. Please follow BMA and watch the space on that. The rest of the parts talk about visa issues for trainees who completed their training. Again, it's only pertinent that with so much of recruitment and retention problems, we need to do everything we can so that the whole process is seamless for these newly qualified doctors. Being an international medical graduate myself, this motion is close to my heart. And as you can see, it asks for more funding for practices so that they can start applying for these visas as sponsors. Nottinghamshire LMC is doing a brilliant job in this aspect. There are already arrangements in place, as well as support in place. If any of the surgery needs, please contact the LMC office. And the last motion talks about driving test prioritization. And again, it's only pertinent that these doctors who have qualified can get their driving license and do home visits and work so that start working as soon as possible and then the driving license enables them to start commuting from their home to workplace and etc. Again, we have seen the pandemic and the difficulties and delays with this driving test. Therefore, the conference is asking BMA to ask for prioritization. All the parts are carried, and this motion is proposed by Dr. Andrew John Wilson from GP Trainees Committee, and I have voted in favor of all the parts in this motion.